Hi, this is Colleen Parsons with Breast Assessment Part 3, and this is going to be very quick as well because we don't do an actual breast assessment. If you work in an area where you will be doing breast assessments, they will teach you how they want them done. But your objective findings are the same as with everything else except for how you go about doing the breast assessment, and I am not going to cover that necessarily here. If anybody wants to know specifically, come see me privately. We do always, because you will be seeing your patient, you will be uncovering your patient to do a lung and skin and cardiac assessment. So you do want to inspect their general appearance and skin. You, as a nurse, are always going to notice everything that is a deviation from normal with all of your patients. You're looking for symmetry. Now, there is going to be a little asymmetry with regard to breast tissue. One breast is usually bigger than the other. Some people significantly so, and it just is what it is. So normally you want to see the skin, the same exact type of skin that you would see elsewhere on their body. If you're seeing any redness, bulging, dimpling, that requires you to step in and either do a focus assessment yourself or have their practitioner do a focused assessment. You also want to be, like we talked about with the part 2, you want to be asking specific questions about breast tissue, breast problems. And I'm just going to pretty much skip over this, looking for any rashes or anything, just in a general way. But you won't be palpating the breast unless you work in a specific area for that. You will, however, have people come to you with questions around these issues, friends or family members, so it's good to have a basic working knowledge. The biggest piece of this that I want to talk about is how to teach breast self-examination, BSE. Help each woman establish a regular schedule for self-care. And it should be at the same time every month. It should be just after they've had their period. That's when the hormones are most, how do I want to say this? That's when the hormones are least apt to affect any lumps or anything like that. So you're going to get the clearest picture of what's going on with the breast tissue just after the period. A woman, most of the breast lumps that are found, women are finding them themselves, and you want to report any of those unusual findings immediately. Early detection of breast cancer is really important. Survival rate is close to 98% if we find it in time before it progresses to a regional issue. We want to keep the teaching simple, so have a simple plan. Describe the plan. There's at least one basic teaching in your Jarvis textbook, but you can find others online. And women can do this right after their shower. Like I said, once a month is perfect. See if you can answer this question. The nurse is teaching a woman how to perform a breast self-examination. Which statement by the patient would indicate a need for further teaching? The best time to check my breast is a week before my cycle. I will check my breast in the shower. 1 week after my cycle, I will examine my breast in a clockwise sequence so that I don't miss any surface areas. I will be sure to check my armpits. Obviously, it's 1, because you don't want them checking before their cycle when hormones are going to affect their shape and any tissue problems. Males should check their breasts as well. It's a lot easier to check male breasts. There's not usually as much tissue there, but we want to definitely inspect the chest wall. So you're always, again, looking for any nodules or problems, lesions, rashes, with men as well as women. And you want to understand a couple things about children. One, it is not unusual for newborns to have a little bit of a milky looking substance coming out of their breast, especially if they're being breastfed those first couple days or up to a couple weeks. It's not significant at all, but it's an important thing for you to know. A friend might call you being quite concerned about that. And all of the developmental competence that if you work in L&D or you work in a prenatal clinic, you'd have to learn all of these other parts. And everybody should be aware of the developmental aspects of aging in women. The nipples can retract, all kinds of things happen. Nipples can retract, gravity is not kind to breast tissue. Women who have had large breasts now find them much lower down to their down into their abdomen if they're not wearing a bra. And the sagging is a problem. It's funny in jokes, but it's not so funny in real life. So you need to again reinforce how important it is for an aging woman to be doing breast self-examinations. And that's it. So the whole breast assessment was very quick.